Dr. Mixon's first rule of medicine is that anything strong enough to help is also strong enough to hurt. The GLP-1 agonists are no exception to this rule. The most common adverse effects of these drugs are bowel-related: nausea, vomiting, abdominal cramps, and constipation, and sometimes, in rare individuals, even bowel obstructions are by far the most common adverse effects reported. Recently, however, there's been a wave of concern on social media about vision problems and even blindness associated with the use of these drugs. As I've investigated the peer-reviewed literature and looked at the original reports, I find that vision loss is rare enough that the studies do not even show an incidence that reaches statistical significance. Now, that does not mean that there's no problem, but it does tell us that the problem is rare. But even rare problems should be avoided if we can, especially since the vast majority of people who use these drugs reduce their risk of heart attacks, strokes, dementia, diabetes, degenerative joint disease, and cancer. Still, there is a subset of patients who should avoid the vision risks associated with these drugs. Diabetics who suffer from diabetic retinopathy should consult with their ophthalmologist and have that ophthalmologist follow them carefully if they choose to use these drugs. There's mounting evidence that people who already suffer from diabetic retinopathy can have the condition made worse by GLP-1 agonists. Also, people who suffer from early cataract formation may find that their cataracts mature more rapidly if they're on GLP-1 agonists for a prolonged period of time. People without pre-existing diabetic retinopathy or cataracts are probably at extremely low risk of any significant vision problems. However, we do need to keep in mind that even diabetics, and perhaps especially diabetics, can reap the benefits of GLP-1 agonists. That is, these drugs will most likely lower their risk of dementia, heart attacks, strokes, degenerative joint disease, and cancer. They have a very good chance of helping them to resolve their insulin resistance to such a degree that they may even stop being type 2 diabetics. Now, that's why I firmly believe that GLP-1 agonists need to be prescribed by a physician who's cognizant of both their benefits and possible adverse effects. These are not over-the-counter medications for a very good reason. And in most people, they seem to be highly beneficial, but in others, they may result in harm. Now, a few other issues. Thyroid cancer. This was an early worry, but thyroid cancer is not a significant issue. A 3.5-year study of 145,000 patients in Sweden, Norway, and Denmark showed no association for GLP-1 use and thyroid cancer. Kidney problems, on the other hand, are generally found to improve with GLP-1 use. Gastroparesis is a lack of contractions of the stomach that slows emptying. It's a fairly common issue in diabetics, and with this drug becomes even more common. In non-diabetics, the slower emptying of the stomach is considered a benefit, since your stomach is not going to empty as fast, and that makes it easier to eat less. Gallbladder problems are more common with high-dose and long-term use of GLP-1 agonists. The gallbladder, like the stomach, does not contract as well, and so does not empty as efficiently. Now, the result is a higher risk of gallstones or gallbladder infections. These drugs are very effective at weight loss, but should not be purchased outside of a physician-monitored weight loss program.